areas of our body frequently develop areas of tightness or shortening that are commonly referred to as trigger points. These areas are very common and associated with the postures we assume, particularly the seated posture. We will demonstrate 3 areas of muscular release using a simple exercise or massage ball. These are commercially available and easy to use. They are designed for the purpose of muscle release as opposed to like tennis balls or lacrosse balls that can often be firm to use on your muscles. Aaron will first demonstrate a release technique for the infraspinatus. The infraspinatus is one of the rotator cuff muscles located on the shoulder blade. It is found just below the spine of your shoulder blade or the spine of the scapula. This area is often very tender and produces pain which radiates to the front of the shoulder. This simple release technique allows the patient to get some flexibility through these muscles that frequently shorten. By placing the exercise ball against the wall, pressure can be used on the rotator cuff. With pressure over the area, one often experiences a significant ache in the region. The infraspinatus is often a pain generator. By trying to do rotational moves of the arm, one can also gain range of motion. Starting from external rotation down to internal rotation are ways of getting more range of motion through the shortened infraspinatus. The side posture here is probably easier for the patient to do and will often feel somewhat painful over the posterior rotator cuff. In the arm, in the more upright posture, this may cause more difficulty for people who have unstable shoulders, but it provides an excellent way of getting range through the infraspinatus. Taking the hand backwards is an externally rotated position, and the internally rotated position really stretches the infraspinatus. Caution needs to be exercised in this position, as individuals with unstable shoulders may feel that they are creating an unstable joint with the arm above the height of the shoulder. These are excellent techniques for the infraspinatus. The next area Aaron will show us is a release of the Quadratus Lumborum. The Quadratus Lumborum muscle goes from the rib cage to the pelvis. It is very commonly shortened and irritable in patients with painful spinal disorders. It is your first spine stabilizer and the last spine stabilizer, and often painful as a consequence of its overwork. Placing the ball against the wall and then applying pressure through the quadratus is an easy way of getting a sense of muscular release and relief from pain. Another muscle which is frequently irritable is the gluteus medius and the piriformis. These are part of the hip girdle, and again, very prevalent in hip disorders and low back disorders. By placing the exercise ball against the wall and placing pressure through the hip, an individual can feel some release through the piriformis and the gluteus medius. Rotating the hip against the wall with the ball in place may cause some difficulty or pain, but is often a very safe maneuver to release these areas of trigger point pain.